Hey everyone, my name is Stephen Burton. I'm a master's in public health candidate with a concentration in community health education and global health. The school I go to is Colorado School of Public Health, but my main campus is the University of Northern Colorado. Today I'll just be talking to you guys about public health, but also kind of talking about the pandemic and specifically to the COVID-19 virus that's going around. And I know you guys have a few questions for me, which I'll get to towards the end. However, I will include COVID-19 related things kind of throughout my entire presentation. Okay, so just to jump in, like what is public health? Some of you definitely now with the pandemic that's going on might be more familiar with what it is. A lot of people might not automatically know what it is, but I'll try to explain it here. So generally, doctors, nurses, dentists, physician assistants, etc., work with patients individually using usually treating diseases. So that is more clinical. It's usually treating people after the fact of some type of disease, some type of illness, something has went wrong, and then those particular types of health focus on treating that. However, with public health, we focus on usually working at the community level to prevent diseases, making sure individuals are able to live their longest, healthiest life. So the key words here is the prevention kind of method. As you can see right now with the pandemic, we're doing a lot of things to prevent people from getting sick, but also preventing mortality and deaths. And that is the biggest thing when it comes to public health. We want to get to people before they're sick, before they're ill, before they need to be seen by a doctor, a nurse, a dentist, a physician assistant, any of those. And there's multiple fields to public health, what I'll break down a little bit later. But the big thing is to keep in mind we work on prevention. So these are just some examples of what public health is. And I'm just going to click through quite a few, but I'll talk about some as well. So we have like Ebola on here. You have e-cigarettes, vaping, like trying to stop people from smoking is a really big one within public health. We also have things like family planning, letting people have a decision on when they actually are ready to have a family. Obesity is a really big public health initiative as well in the US due to our just high rates of obesity compared to other countries. Also, some of you may be familiar with Black Lives Matter and that of police brutality. That also falls within the realm of public health and trying to prevent high rates of certain communities being targeted or also looking at the mortality. STDs, texting while driving, unemployment, all of these kind of things are different fields within public health that public health all looks at. And there's also like the opioid crisis, which is over the years has gained a lot of traction um, as a lot more people when it comes to physicians administering medicine. So that's a big one. So what else can you do in public health specifically? So I'm going to use the coronavirus as an example. And these are kind of different ways that we use public health. We find topics and we address it this way, regardless if it was coronavirus, obesity, um, opioid crisis, things like that. You still can target it this way. So you can design and implement interventions. At the moment, when it applies to the pandemic of the COVID-19, we don't necessarily have interventions at the moment because it does take a lot of research and testing and getting participants ready to be part of an intervention, but eventually we will be implementing our interventions. You can monitor locations of cases. I'll definitely talk more about that because one of your questions talks about epidemiology and specifically monitoring location of cases falls within the realm of epidemiology. You can write policies to impact health. There's a lot of policies going around now when more of the governmental impacts on public health. When you look at we as public health professionals, we suggest here's the data, this is what it's saying, and then we allow policies and governments to kind of implement those or help us implement. And you can reduce stigma and racial discrimination. With the coronavirus, as some of you may or may not heard, certain Asian identifying individuals in the US, or I guess globally as well, have been targeted, as some people have assumed that Asians are more likely to be contaminated or to be infected with the coronavirus, and that's not true at all. Viruses do not racial discriminate, they will just attack anyone. You can also work internationally or locally. Mine specifically is also the global health education, and that's specifically what I want to do. With the pandemic that's affecting every country, this is definitely another field in public health that is being brought up throughout the media all the time. You can also work with specific populations. Personally enjoy working with kind of rural communities, especially like Native American communities or other communities that are not necessarily like the big mainstream or smaller communities, lower income communities. Those are the types of communities I find great to work with, especially when it comes to a global perspective. I'm able to travel the world and learn more of the culture and kind of be part of those communities in some way. And we can also have like health promotion and also design marketing campaigns. And that kind of ties in with interventions. But if you have a campaign to increase childhood activity, physical activity to reduce obesity, those are specific types of campaigns that are targeted towards childhood obesity by increasing physical activity. So to go over just some social determinants of health, these are things that are kind of these invisible kind of factors that impact either individuals or communities' health. If someone has a lower education, they're more likely to suffer from um, lack of access to healthcare and a whole other number of things. But the thing is, education is that social determinant of health. It determines if you have higher or lower education and how it impacts your health. If you live in a food desert or food swamps, which are usually you could think of areas that are high in like fast food restaurants that don't really have a lot of um, like excuse me if they don't have a lot of whole foods and fresh vegetables, those particular areas would be more likely to be healthier compared to individuals and communities that are surrounded by fast food. You have healthcare systems. Some healthcare systems are not as well developed as others. I personally find it very fascinating to understand other countries' healthcare systems. Anytime I travel to other countries, I'm always asking how, in what ways is it different from the US? And that's a really cool thing. If you ever do travel, definitely just ask around the locals to kind of figure out how their healthcare system is. And it gives you a really interesting perspective of the US healthcare system. And economic stability, with those obviously with more income, they're more likely to be able to get those yearly checkups, be able to pay for health insurance and things like that. Lower income, then it definitely can impact your health. Community and social contacts, for those depending on what community you're in. If you have social networking, social support, all of that can impact your health and also your neighborhood and physical environment. If you live in an environment that doesn't have sidewalks or public roads that are easily accessible, all of these can significantly impact your health depending on the state that it currently is in. So why did I specifically go into public health? Me personally, I was working in a pediatrics ER. I was in the process of actually going into physician assistant program. But it was at that moment working in the ER that I noticed that a lot of kids that were coming in had pretty preventable illnesses, definitely a few deaths that were completely preventable. And that what really got me to start looking into why were these cases coming in when this should have been avoided. And that's when I came across the field of public health. But also, I knew I wanted to do more global kind of health in the sense of working with communities. And that's where just looking into research. And at the moment, I was living in Mississippi, and they did not have a master's program. And I have my bachelor's in biological medical science. And I know one of my masters in Colorado had an absolutely amazing public health program. And that's what got me here. And just like some backgrounds and just education for anyone that was kind of thinking about going into public health, we do have, you can get your undergrad in public health if you want to. As I mentioned, got mine in biological medical science, which is in a sense can definitely be, any bachelor's could be tailored towards a master's or a doctorate. And master's, as I mentioned, mine is community health education and global health. I'm thinking about getting my DRPH, which is just more if you want to do PhD is more like research, and the other one is more getting out to being academic. um, the DRPH, and just some interesting fields. It does take quite a while to get your doctorate. Most master's programs are a 2-year program, pretty easy to get, but you can start out in your undergrad to kind of see if it's a particular field that you would like to be part of. And I just want to go over as well just how to even apply for a master's program. We throughout the entire U.S. we use sophis.org, which is very, very amazing considering most schools they have different application process. Regardless of what master's or public program you get into, you will use this website. You can just put everything in there, like your transcript, letter of recommendations, test scores, statement of purpose, all of that in one location. Very, very helpful. If you wanted to find out more about public health, you could go to these particular social media accounts. Like Facebook, we have This is Public Health, Insta, This is Public Health, Twitter, TIPH tweets, Snapchat, TIPH underscore campaign. And those are just things you can watch current This is Public Health ambassadors, which I am for this year, which I'll be ending by the end of this month. I'll end my 1-year ambassador program. But you can see new incoming ambassadors and see what they're doing in the field of public health. And so to jump into some of the questions that I was given from some of you guys, you asked that what has my experience been like as a public health professional during this time? At the moment, I work in a mental health hospital, and every hospital I've ever worked at, they've all had a public health department. Thankfully, at our hospital, we're making sure that every faculty member is wearing some form of PPE. Definitely have to wear a mask. We have some patients that may or may not, since it is a mental health hospital, they might not be willing to, which is understandable. But overall, my experience is more just of understanding. I understand all of the reason for the lockdowns, the quarantines, all of that of shutting down countries. Those are things I've just been studying for the last 2 years, and I completely understand it. It definitely impacts even public health workers as well. Pretty much all of my professors as well are stuck at home just like everyone else. It's not necessarily anyone getting special treatments, if that's a kind of thing. But yeah, so how vaccines might be developed. Pretty much vaccines take quite a while to be created. And it's just more so because each human being is definitely different. Viruses sometimes have a tendency of mutating. But kind of the beauty, I guess, with the COVID-19 is that actually multiple countries are working together to speed up that process to find a vaccine, which is not something that normally happens. So it's really nice to see multiple countries working together on this. So vaccine is definitely coming. I'm sorry, I realized I asked the question twice. But yeah, so a vaccine will be coming eventually. And yeah, so I don't know what the third question might have been, but so how epidemiology can be used to lessen the spread. And this is what I was talking about specifically with the epidemiology earlier. This is pretty much as we have the social distance, trying to make sure people stay at home. All of this is, as you may have heard, of flattening the curve. That's pretty much to give our healthcare system and hospitals the time to get prepared, pretty much get enough ventilators, staff to get set up to be able to treat enough patients. If we don't flatten that curve, you have like multiple people that are sick going to the hospital, and at a point you run out of beds, you run out of ventilators. And so for someone that might have been, say, for example, going into labor or maybe in a car wreck, if they get to the hospital and they have no beds or no staff to see them, then also their part, they're likely to increase in mortality there. Especially with COVID-19, it's just such a quick virus that can like shut down when it comes to breathing wise. And you need those ventilators. If we run out of ventilators, that's what increases those mortality. But specifically also with lessening the spread, there's something we're trying to do with contact tracing, which is actually a job I'll be applying for over the next few months, or hopefully working with over the next few months. But that is after we get enough testing to see who is positive, who might be negative, we'll be able to trace the virus and be able to let other people know, oh, you may have come in contact with this person, you need to isolate yourself. And that right there helps slow the spread until a vaccine is available. There are some countries that are doing this type of herd immunity. Usually you need a vaccine to do a herd immunity. So it is a little bit controversial, such as Sweden and Colombia. Those are some examples of countries that are doing the just let um, their citizens pretty much slowly be introduced to the virus so they could build their own antibodies for it. That is definitely not a method that any and everyone should take, more so because you just don't know how this virus will act with your body. It is a new virus to us, and some people may have symptoms that are very similar to just like a cold or flu, and then others may have very severe symptoms where their lungs pretty much start filling up and they're no longer able to breathe. But hopefully, we'll see, especially as public health workers, we will be watching all of this as it unfolds to see how other countries responded and the results from those. There's also environmental impacts, as some of you may have seen in like China, where or even Italy, lower pollution rates. A lot of like Venice, cleaner water because there's less traffic, and especially like in India, if you could find pictures to see how drastically different pollution rates in India has changed. All of that is in the realm of public health that I personally find fascinating to research and we'll be keeping a close eye on over the next few years. So if you do want to find out more about public health, by all means, just email me or if you have other questions specifically around public health or COVID-19, I'm more than willing to answer them. I hope you guys are ready for your summer and can enjoy it as much as you can. And thank you for listening.